Hello everyone, welcome back for another edition of Virtual Yin Yoga. I'm your instructor Mike. I'm happy to have you with me this evening. For tonight's practice, we're going to be doing a hip series. This is particularly designed for those who do struggle with hip pain, which is a really common thing. It's just as common as having pain in the lower back. So I wanted to make sure that we can have a practice where we can do our best to treat that kind of pain if it's happening, or even prevent it from happening to you. But a few things that you're going to want to grab before we get started: a yoga mat if you got it. Definitely want to have something to lay on, unless you got some carpet, in which case it's totally fine, just lay on that. You may want a yoga block or a pillow if you don't have that. A blanket can work just as well as a block. You just got to fold it over, position it how you need to. You may want to have a yoga strap. If you don't have a yoga strap, hand towels are always excellent props and excellent substitutions. And not only can you use it for a strap to use for leverage, but you can also use this for cushion. You can always roll it up and put it under your neck or put it under your glutes or something like that. But there's going to be some ways that we use some of these props, so heads up on that. You may want to grab those. And you can pause the video. When you got it, go ahead and come back and then resume this. But if you're ready, let's go ahead and get this started. Let's go ahead and lay down and close your eyes. There's nothing to see at this point, just more to feel and pay attention to. And I want you to focus on your breath and breathe low in your belly, low in your diaphragm. If you want to double check if you're doing this correctly, place a hand on your stomach below the belly button. You feel the stomach expand when you take an inhale. It contracts when you take an exhale. And this is belly breathing. It's the breathing technique that I recommend for our practice because it's a slower paced practice and we want to slow the body down. So breathing low in your diaphragm helps with that. It slows the heart down, slows the nervous system down, slows the mind down. Your mind might wander in the practice. Don't beat yourself up if it does. It's all a part of this. But if you need something to pay attention to, just focus on your breath. It's always there for you. What we're doing with our practice is a hip series of yin yoga. Yin yoga is just a gentle form of stretching where we hold postures for an extended period of time in very passive ways for minutes on end. Roughly 2 to 3 minutes with each individual pose that we do with this evening's practice. But times are arbitrary and subjective. So if your better judgment leads you out of something early, that's fine. You don't have to hold the pose the entire time. But if you feel comfortable, you want to hold it the entire time or a little longer, that's up to you. But my advice to you is to let experience be your guide. Let your body tell you what you need to do. But during the hour, if you find yourself struggling, listen up to the modifications and suggestions that I make throughout the practice. I like to give options for you to work with. So if you find out a certain pose isn't working, listen up to those modifications or listen to the substitute poses that I suggest. And a lot of times we can work our ways around that to find the most effective stretch for you. When you're ready, go ahead and open your eyes. We're going to start our practice off loosening up the hips and the spine. So just go ahead and continue laying down. Bring your knees up to the chest, cradle your legs, rock up and down on the spine, side to side, make circles. Just take this opportunity to wake up, again, these deeper areas. Hips and spine are what we primarily focus on when we do yin, but we're going to do more emphasis, obviously, on the hips today. So that means SI joints, the pelvis, the hip flexors, the IT bands. Here we're gonna be working all of these areas. There still will be some work on the spine, but again, primarily focusing on the hips today. And with that in mind, we're actually going to start this off with a twist. I'm just going to continue laying down, and you should as well. If you want to coordinate direction with me, I'm going to twist to my left. So I'm bringing my knees up to the chest, legs over to the left, and just laying them on the floor. And this right here is the pose. And we can modify this as much as we want to. It just depends on if you feel like you need to go deeper or if you actually need to decrease it. And I'll explain both of those as we go on. But it should be a broad side body stretch. If you're going to the left, it's lower right side of the back, outside of the right leg. as your intended area here. With this though, if you start feeling any pain, very localized in the back of your hip, we're talking back right hip, anything in that area is overstretching, you're going to want to use a block. I would also recommend using it if you can't get the knees together or if you can't get your legs all the way to the floor like so. You're going to want to use that prop to put in between your knees, under the bottom leg, or both. So again, a block will work there, a pillow or a blanket will work as those substitutions. Now if you're comfortable here and you're feeling plenty of the stretch, you got that broad side body stretch, feel free to play around with a couple of modifications. You know, some people are going to take their arms out to the T. I'm kind of blocked here, but if you need to, you can open arms out to the T, get yourself a nice chest and shoulder stretch. It's going to be the right chest and shoulder that actually gets the opener. But some people like to have their arms above the head. You know, arms above the head can get you a little bit more oblique and side body stretch, hit those triceps. It really just depends on how your shoulders feel themselves. So if it starts to aggravate your shoulders to have your arms above your head for too long, just keep them more towards your side. If you want to stretch your neck, look away from the legs. So legs going left, look right. Or if you want to stretch more chest and shoulder, you got the arms out to the T, you look with your legs. So if your leg's going left, you look left. It's going to open up that shoulder a little bit more for you. Do all of those if you want. You don't have to just pick one modification. You got plenty of time for it all, right? So do whatever you need. But the last thing to adjust will be your legs. And keeping your knees stacked is usually how we start. If you do need more, you take your right leg over the left leg. The more this right leg crosses over, the top leg crosses over, the deeper the rotation of the pelvis, and that is what increases the stretch. I would only recommend it if you're feeling little to nothing with your knees stacked. And again, if you can take this over, you got the broad stretch going, you're A-okay. But if you take it over and it starts to feel like it's too much with the localized straining pain in the back of your right hip, don't do it. Or if you're noticing like your core and your back muscles start to flex, if they start to really tighten up, it's your body resisting it, in which case dial it back, keep the knees stacked. I want you to be able to let the muscles soften. If they don't soften, you're not getting into the joint. So decrease the intensity so that can happen. Be, again, more efficient for you this way. If you're ready, though, we'll say that's the time. Just really slowly unwinding from your twist. Take your time on out of here. You can just lay for a little bit if you'd like to, or you could always bring your knees up to the chest, cradle the legs again. I will usually just lay here and resist the urge to move. Okay, so you do whatever you need. You got a minute, though, to do so. Other side though, if you are ready. And if you're on the same page as me, you're now going to the right. But just make sure you are on your other side. Really, that's what's most important here. But if you are twisting right, it's lower left side of the back. This can be the intended area. Maybe the outside of your left leg, maybe your glutes. But two sides are different. So if you get here and you notice that, it's really not abnormal. Maybe on this side you can't get your knees together, you can't get your legs to the floor. Use the block, especially if you're not able to do that, or if you feel the localized straining pain, it would now take place in the back left hip. Put that block in between your knees, under the bottom leg, or both. And again, you could use a pillow or a blanket to substitute for a yoga block. You can stretch your neck by looking away from the legs, so legs going right, look left, or stretch more of your chest and shoulder by looking with your legs. That would involve the arms out to the T modification though. That would be the inside of the left chest and shoulder getting the opener. But you could also have arms above the head for a little bit oblique and side body stretch at the triceps a little bit as well. It really just depends on what you did on the other side. So just do your best to do it here. Last thing though is the leg. Keeping the knees stacked is usually enough, but if you do need more, you take your left leg over the right leg, top leg. The more that left leg rotates over, the deeper the pelvis rotates. And that is what increases the intensity of this particular stretch. But if you don't need it, that's fine. Some people absolutely don't need it on this side, but they do on the other, or vice versa.
And just listening to your body is what's most important here. So don't feel like you got to go as far as possible. Don't feel like you gotta be symmetrical, because you don't have to be symmetrical. You know, everybody's asymmetrical with their body. And I don't want you to flare up anything with your SI joints, those joints in the back of your hip. Usually when people have hip pain, it's going to be in one of those two joints, in the back left or the back right hip. And partly the reason for it is it just gets stuck together with what's called fixation. This is a temporary thing, but when a joint gets stuck together like that for too long, over years and years and years, the connective tissues will calcify around it. They'll harden, and then they turn that joint into a bone. So that means you're no longer moving it as a joint, because it's not a joint, it is a bone now. So it has a different range of motion, and it will be extremely limited in that. Now I'll talk more about that as we go along, and why it's so important to do yoga to prevent that kind of fusion from happening. Go ahead and take a few deep breaths, and when you're ready, there's your time, just really slowly unwinding from your twist, and you take your time out. You could just keep laying down, or you could bring your knees up to the chest, cradle legs, just whatever you need. You got a minute to do so. Get the IT bands next. The next target area we're going to work into, it's going to be our IT bands. It stands for iliotibial band, and it runs from ilium to tibia. It's on the outside of your leg. So whatever leg you're going to stretch, it's going to be the outside. But if it feels like you're getting pain in your hip or in your knee, listen up to the modifications so we can work around that, because we don't want to feel that. Normally, we do something like the Swan Pose. It's also known as pigeon, if you've done any other style of yoga. I would recommend that if you want, or if you want to try something out. If you're close to a wall, I might recommend what I call eye of the needle up the wall. Now, a long time ago, months ago, we did just a regular eye of the needle. I'll talk you through this one too, in case you don't want to use a wall or if you don't have access to one. But what you do, still again, outside the leg, let's cross our right leg over. You're going to rest your right ankle on your left knee. It's going to be the right leg that gets a stretch here, just so we all know where it's going to take place. What you're going to do, you're going to take your right hand, it's going to thread the needle, that little hole right there in between your legs. The left hand will wrap around, and both will grab onto the left shin, right? And this is the pose right here for you. You should feel the right IT band stretching the more you pull, right? But if you don't want to use muscular effort, there is a way that you can use the wall. So just imagine that I have one with me. If I had my left foot up against the wall right here, this would provide the same leverage as opposed to grabbing and pulling. So if you're close to that wall, put that left foot up it. And if you need to increase the stretch, you just slide your foot down, decrease by sliding it up, or play around with how close you are to the wall. So if you're really close to it, usually it's going to increase the stretch for you. The further away, the more it decreases. Now, since I'm teaching, actually I think maybe I'll do something else. Sometimes I just like to play around with these poses myself, see what works and see what's not going to work. I was feeling it plenty in those poses, but to be honest with you, I really don't like to use too much muscular effort here. I mean, I will teach it to newer students in case they're really, really inflexible, or if they have some previous injuries that they got to overcome. And the reason why it's beneficial to use muscular effort poses in those situations is because the student has more control over the stretch, right? If you aren't getting enough, you keep pulling. If it's too much, you just let it go, you're right out of the pose. But it can be difficult for other postures. So that's why I usually will recommend muscular effort poses first, and then as they progress in their practice, to start using gravity. But right now I'm doing what's called a shoelace pose, in case you ever want to try it. You just cross your legs over, you stack the knees on top of each other. It doesn't have to be like perfect, but this is the emphasis. And it's still outside of the top leg. So there's
a couple of different poses, and there's no right or wrong on it. You just got to go with what feels best in the moment, and we don't know what that's going to be until we get there. Like you just saw me experiment with the pose. You know, this is just the one that's feeling better today, so I'm going to do it. If you are ready, use your time, use your hands to push yourself up, uncross if you're doing a shoelace, uncross your legs if you got your feet up the wall, and you could just stay there. But if you're not using the wall, you just lay down. You know, one of the perks of using the wall there, aside from making it easier for you, being able to rest your feet up the wall is actually a really rejuvenating thing. Normally our blood, just with gravity, will collect in our legs. So when we invert ourselves with the feet up the wall, all that blood that normally collects there has an opportunity to run up into the torso, up to the organs, up to the brain. So it's kind of like new blood being recycled there. It's really, really rejuvenating. Other side, if you're ready, whatever side you happen to be on, because everybody's probably on their own page here. Now I suggested Swan Pose, I suggested Eye of the Needle, I suggested Eye of the Needle up the wall. I didn't really go too into detail about the Swan Pose, it was more of the other one. So I'll go through this one again, where you lay on your back, you cross a leg over. Let's say you're crossing your left leg over now. You would have the left ankle around and wrapped, left ankle on the right knee. It would be the outside of the left leg getting the stretch. You take your left hand, you thread the needle, right? It goes in between that little hole there. The right hand wraps around. You grab onto the right shin with both hands and you pull. Right? The more you pull, the more you get. Muscular effort required here. Now, if you're, again, close to a wall and you don't want to use muscular effort, you let go, you have your right foot up against the wall here. So just imagine I got one, right? And the lower the foot comes down the wall, the more it will increase the stretch for your leg. So your left leg now. So just keep that in mind. So again, higher up decreases, lower increases. Scooting in closer will increase as well. Scooting further away will decrease it. Just making sure your knees and your hips are fine. Now I'm doing a shoelace pose. In case you did it on the other side, you want to do it here. You cross the legs over, stack the knees on top of each other. Again, doesn't have to be, again, 100% perfectly crossed there. Just has to have the emphasis. Feel the outside of the leg. Now I'm getting my left one here. It's the top leg for this. The reason why I suggest a lot of different options is because the IT band is a really difficult area for us to find a comfortable stretch because of all the variation that comes amongst us with our hips. And again, it's not because of flexibility, it's because of the literal shape of the hips and the skeleton itself. So that's usually why I'll suggest one pose with a whole bunch of different modifications, or I'll suggest a couple of poses with a few modifications. Yeah, I can't really go wrong in that because usually you're going to find one some way or another. But IT band's really important work. And if you have issues with your hips, you need to be working this area. People who are runners and spinners and anybody who does that kind of repetitive activity over and over again, they're going to have tight IT bands. It's guaranteed. People who sit a lot, tight IT bands. For those who suffer from sciatic nerve pain, this is definitely going to be a pose I would recommend, or an area I would recommend you stretch all the time. And the reason why, the last study I read, this is from the International Congress of Fascia. This is like a whole conference of the world's leading doctors that study fascia and connective tissue. They met last year in Berlin. And one of the discoveries that they had found is sciatic nerve pain most of the time is not because of bones squeezing the nerve. That's what they used to think in the SI joint itself. But it's actually because somewhere in the IT band, that connective tissue of the IT band itself has wrapped around the nerve and is now squeezing it. So that right there is actually why you're feeling sciatic nerve pain. So what they suggest is stretch your IT bands. Get the layers of connective tissue that have wrapped around it to loosen up a bit, and then it can relieve the pressure so you don't have to feel that nerve pain. So again, it's not just because bones squeezing into each other or even muscles squeezing into it. It's because the actual connective tissue itself has wrapped around that nerve. So again, to fix it, stretch it out, it loosens it up, lets it go. When you are ready, it's time. Path of least resistance out, whatever pose you happen to be in. And take your time, lay down a little bit.
Short breather. Just try to feel all the effects of these poses. What does that leg feel like after holding a pose for so long?
The next target area we're going to work into is going to be our inner thighs, the adductor muscles. With the inner thighs, I often will suggest two poses, but I'm going to suggest a third with our practice today. One that is specifically more for the hips. And it's a variation of a pose we always do, the butterfly pose. And I'll just go ahead and explain this one while I'm here. Butterfly pose, you have the soles of the feet brought together in front of you. You fall in round in the pose best you can to get your inner thighs and get your back stretched. So if you want some back work, here's where it comes in. Just be mindful of your knee and your hip. Any knee pain, any hip pains, bail out of the pose. You're probably going to want to do dragonfly, which I'll explain here shortly. But the variation of butterfly pose is called reclining butterfly, where you have the soles of the feet together, but you just lay on your back. And I'll flip over here from the side. So again, soles of the feet together, laying down. This is the pose. And again, it's more for the hips because it keeps your pelvis and your sacrum level with the floor. So if you want more hip work, I would recommend doing this pose. And I'd actually recommend using some kind of prop to help you out here. I usually will get close to the wall. If you're still close to it, feel free. And the reason why I'll use the wall here is to prevent my feet from sliding out. Actually, I'll lay down again. So when I lay down here, if I don't make any muscular effort here, if I relax all of my body, all my hips, you see how my feet are sliding out here? And now I'm losing the pose, right? Because my muscles have softened to the point where I can't hold my legs in anymore. So, but this decreases the stretch. So what I'll do, I'll get close to a wall and I'll have my toes up against it so it keeps my legs stable and I don't have to use muscular effort to hold them there. Because right now I'm actually flexing my quads to make this happen. It's really uncomfortable. So I'll put that wall there, I'll get close to the wall, keep my feet, my toes right up against it, and then I can do the pose and relax. But again, that's just a specific case for me personally. The reason why my feet slide out so far, I have really long legs, right? That's just nothing I can do about that. The only thing I can do is accommodate for it by using a wall, by using some kind of block to prevent my feet from sliding out in front of me so I can relax in the pose. And like I mentioned, we need muscles to soften if we're going to get into the joints. So whatever prop, whatever device you can use to make you relax more and have those muscles soften, use it. It's not cheating to do that. You're being smart and you're making educated decisions on how to better yourself in your practice by using a prop. When you are ready, say it's time, just use your hands, push out if you're in the forward bend, lay down. If you're already laying down, you're already where I want you, just keep laying where you are. Slide those feet out, take it easy. You got a minute to relax. In a moment, we're gonna get the hamstrings. Next target area that we're going to work into is going to be our hamstrings. We're going to do both at the same time with caterpillar pose, where you have both legs out in front of you, you lean forward, and this is the pose for you. Back of your legs and low back. I just want to show you from the profile view because I'm about to switch over to the head-on view. So you're going to grab something. It could be knees, shins, ankles, around the feet, toes if you can grab them. It is not a toe-touching competition, so if you can't touch toes, do not worry about it. It's not the point. The point is to stretch your back and the back of your legs. And even though this is more for the spine, it does work the hips, it does work your SI joints, and that's something we've been focusing on a lot in this practice. But anytime you bend forward, you're decompressing and creating that space in between the SI joint. In case you're not sure what SI means, it stands for sacroiliac joint. So it's the joint where the sacrum and the iliac meet each other. Sacrum is the very base of the spine. Iliac is one of those big bones in your hips. So again, that's where the hips and spine meet each other. And most people are going to have issues with it, which is why I'm suggesting so much work for it. Just want to maintain that space. Like I said, fusion can take place if we don't move it, if it stays stuck for years on end. And there was a study done a couple of years ago on men in their 50s, 60s, and 70s. And what they did during the study was they took x-rays of the back of their hips because they wanted to see if there was any fusion taking place in one or both of the SI joints. Men in their 50s, around 30% of them, had at least one or both of the SI joints fused together. Men in their 60s, it went up to about 50%. Men in their 70s, closer to 70%. And that just comes from lack of movement. They have not moved, most likely, for the last 20, 30, maybe even 40 years of their life. And that's troubling. It's really troubling to think about. And the scariest part about fusion is it doesn't go away. There's no treating it anymore because it's no longer treatable. When fusion has taken place, it's no longer a joint, it's now a bone. And we don't want to have that happen to our SI joints. And the reason why is because once they fuse, your lumbar spine has to do more bending. And now that your lumbar is doing more bending, it's going to suffer. And then it's going to turn into, I got to bend some other way. And then it's going to start bending more from your knees than anything. And there goes the knees. And before you know it, it just hurts to move, so you just stop moving. It's one of those vicious cycles we get into. So keeping up on keeping the hips and spine healthy is so important of maintaining our mobility. This is why I love teaching this practice more than any other practice. I mean, strengthening is really important too. You got to move, but you also got to be able to stretch. Right? If you're not flexible, you can't really move. When you are ready, use your time. Use your hands. Slowly push out. You lean back. You lay down. You take your time on that. There's no rush to go anywhere. Always take a minute off in between a pose, and even in between sides. We have two more things left to do. We have to stretch our quads, most likely just working our hip flexors, but then we also have to do a back bend, and then we're going to wrap this practice up. So with our quads, we're going to do one at a time, and it's going to be in the dragon pose, which is essentially a lunge. I'm going to show you a couple of different angles so you can wrap your mind around it. But again, quads are the upper thighs, front of the legs. The first option with the dragon pose, it's basically a lunge, right? You got one leg behind you, you got one leg in front. It is the back leg right here, through that back leg, that's going to get the stretch here. So there's a lot of different ways to approach this one. Right now, I'm stretching my right leg. And if I want to increase this a little bit, a lot of times I'll find out that I can prop more upright like I am doing a lunge here, or maybe I'll turn more into my front hip. So let's say my left leg is in front. That would be the side to turn to. So I'll turn left. And all of a sudden that increases right there throughout that right quad. I'll show you from the side here too though. Sometimes I think it's easier to see it from both ways, both profile views. So again, my left leg's in front, I'm turning to the left to dial up the intensity for the right leg. Pelvic change is all it really is. And again, I wanted to make sure that we work the hip flexors because it's a really important area. Most people are going to struggle with this one too. And if you're too tight in your hip flexors, it's going to cause a couple of issues. It's going to start pulling your pelvis forward. It's called an anterior tilt when the pelvis goes too far forward. It causes L5, S1 pain. If you've ever had it, you probably had it in that joint. Most likely it's because the hip flexors are too tight, or it could be hamstrings. Usually it's one or the other. But also because one of the muscles of the hip flexors, the psoas major, it's connected from your hips to your spine as well. So when that muscle becomes too tight, it starts to pull your spine forward. So again, making sure we're staying up on that to prevent that issue is really important too. And I don't know if you're paying attention, I just did a modification here where I'm taking this back leg, letting it bend, and I'm reaching back to grab it. So I have my right foot grabbed by my left hand, just to dial up a little bit of the intensity here. This is completely optional. If you want to try it, but you can't grab the foot, here's where a strap comes in. You can just loop it over and pull on the strap. You could always have that strap even in front of you. You don't necessarily have to have it so far back behind you. Different ways to do it. And when you are ready, there's your time. You let the leg go. You can slowly make your way back into what we call a runner stretch. Stretching just the left leg, straightening it out. Wrap it back though for a child's pose. You can just take your time while you're here. Other side, if you're ready, is whatever side you are on. I am on my left side, my quad of the left leg. So my right foot is in front, my left leg is behind, right? So it's all throughout the back leg, the left leg right there, the front of it. I did forget to mention, but I will do it now, bone to floor pain is not therapeutic. So if you need some padding, you can take your mat, fold it over, place it under that knee. You could take the towel, you could take a blanket and do the same thing. Just have some cushion under that knee if you feel like you need it. You could always use a block here too. You could always just rest your hands on the block. Sometimes that'll make this a little bit easier for you too. Just holding yourself up like this for after a while is pretty uncomfortable. It's essentially like a 3-minute plank for some people, holding themselves up like this. Just remember to breathe. Some deep inhales, deep exhales. Don't worry about how deep you go. Don't worry about looking like me. Just making sure you're feeling right there in the front of your leg. It's going to be more up towards the top of the pelvis though with the hip flexors, right? Because that's what we're truly intending on working here. If you do want to attempt that modification of bending the back knee, I mean, you can try it. Bend it, reach back with your right hand, hold it. This depends on, again, which side you're stretching. If it's the left leg, reach back with your right hand. If it is right leg, left hand. And the reason why is because you have a wider stance reaching back with this particular method. Because if I was going to reach back with my left hand, you see how my balance is a little bit off now? So it's a little bit more uncomfortable here. But wider stance means easier on the balance. It's actually one of the modifications I would suggest you do too. If you're doing like a strengthening style of yoga, if you are really, really struggling on your balance, widen your stance a little bit. It's going to make things a little bit easier for you. Now when you're ready, it's your time. Really slowly letting yourself out, head maybe to that runner stretch or just right into a child's pose. So we will take that minute, we'll do our back bend. The next and last of our yin postures is going to be a Sphinx pose. We've got to do a back bend. Even though it doesn't really have much to do with the hips, if you do any amount of forward bends, you got to make sure you do a back bend just to complement, kind of counteract that. So Sphinx pose, you lay on your stomach. Prop up on your forearms, your elbows. This is the pose. Not a stretch. You should feel that dull pressure right there in the lower back. It's all it should be. Anything sharp, you come down from it. Don't push through sharp pains. It's not therapeutic for you. And it never will be. Usually it's you compressing a nerve or an artery. You don't want to compress nerves for too long because that causes nerve damage. You don't want to do that to an artery because it then impinges blood flow. It's little things like that that are really important to know. Now if you're not getting enough of the bend here, you're not feeling enough compression, there's some modifications you can do. You can always lift your feet up like this, which will tilt your pelvis and your sacrum to go forward, increases the bend. Might be all right, but it might be too much. For me, it is a little bit too much. I start feeling my quads spasm again, and every now and then I'll feel the sharp pain. Most of the time, though, it's just because muscles are flexing to make that happen. So if I ever do this modification, I once again will scoot close to a wall. So I can rest my toes, my feet up against the wall. I don't have to make any effort to keep them up here. You could always push up into a seal pose, upward dog, cobra if you've done any other style of yoga. Try it out for yourself. Just make sure your hips stay on the floor. I have to do it in a modified way. If I go any deeper than this, my hips will come up. And actually, maybe it's worth showing. I'll bring my hands in. Watch my hips. You see how they've lifted up? I'm way past my full range of motion. I'm actually overextending here. That's going to risk an injury. So I'll slide my hands out to find where my hips touch the floor, and this is my full bend. This is where it's therapeutic for me. It's no longer overextending. But here and here with the elbows down, I mean, there's minimal difference. You know, this is just, it's just easier to have the elbows down as opposed to extending the arms. But if you have a really deep back bend, push up, go into that seal pose, and just take the note of where your hips come up from the floor. The moment they come up, you have reached full range. Don't go past that. Stop there and probably decrease it just ever so slightly. If you're ready, there's times real slow, lay on your stomach. Take your time here. It's going to feel nice to do a gentle forward bend after a deep back bend, so maybe like a child's pose or laying on your back and cradling the legs. If you want a gentle forward bend that also works your hips a little bit, you may want to try out the squat pose. We've done this one before, squatting. Here it is. Just making sure your knees are fine is really what's most important here. And heels do not have to touch the floor. If they're lifting up, that's okay. It's either because you're too tight in your Achilles tendon, which you could stretch, you could get the heels down, or it's because you're feeling this bone-on-bone pain right here in the front of the ankle. If that's the case, heels are never going to touch the floor. Now you can try to widen your stance a little bit by turning your feet out. Sometimes that will help because you don't have to have them straight on. But most of the time it's not going to make too much of a difference. Even though the issue is here, manipulating another joint with the femur and the hips, that can sometimes work around getting the heels to the floor. But again, don't feel like you have to achieve that to get the functional purpose of the stretch. We are at the end of our practice. Go ahead and lay down. Take a moment here. Close the eyes. There's nothing to see at this point, just more to feel and pay attention to. Go ahead and focus on your breath. Breathe low in your belly, low in your diaphragm. Turn your senses, your awareness within. And for the last few minutes, give your body a compare and contrast. How different do you feel right now as opposed to when you first started your practice? What differences have you made with the practice itself? No formal ending to our practice. Keep your eyes closed as long as you like, but that's officially all that I have for you. I want to thank you all for watching and sharing your practice with me. It's been my pleasure.
Namaste.